Hi, this is Dr. Derek. Today I'd like to talk to you about shoulder pain. Shoulder pain is a common occurrence that I see in my office every day. When we talk about shoulder pain, you can be talking about the shoulder complex itself, or a lot of times people equivocate shoulder pain with pain here in the trapezius muscle, this muscle here in the traps. Just for time purposes, I want to talk to you about and focus in this video on the pain in the shoulders in regards to the trapezius here. So this muscle here, the trapezius, is one of the largest muscles in the body. And this gets tight when we are on the computer a lot. Just watch what happens when I work on my computer figuratively. So I bring my arms up, look what happens to my shoulder. Shoulders raise, and this trapezius actually shortens and tightens. And when a muscle is like this for a long period of time, the muscle actually gets shorter and stays in that position. And then when I bring it down, now it pulls and it's more tight. To illustrate this point, I have this rubber band here, and people think of like their muscles like a rubber band. So if the muscle is this length and I shorten it, this is what happens to the muscle. Just relax, and then when you go back to the state again, it goes like this. It doesn't work that way. So how it works is when I shorten the muscle actually shortens, and then when I go back to normal, look what happens. It gets tighter. Then you feel all this pain in here. So it's this common thing that we see with people. They have this pain and they're always trying, hey, will you rub my shoulders? And we can do that. This is what happens when this muscle gets really tight. So today I want to talk to you how you can fix that yourself and how you can clear it with like a tennis ball. Okay, here's the greatest massage, cheapest massage here on the planet. Just grab a tennis ball and you're going to focus on 3 key areas. So you can work on just the belly of the trapezius itself. You just kind of have to lie on your back and just kind of push into that area. The other area is right between the shoulder blade and the spine, up and through here, and just move up and down the spine, up and through here. And then a key one that most people miss is where the trapezius inserts onto the spine of the scapula, right in through here. This is key, really letting it dig in through here. So you're going to have to get creative on the ground. I'm not going to show this to you on the ground because I don't want to dirty my shirt and all, but you just kind of lay on the ground and just kind of dig into this area. So let me show you what it looks like on the book. So over here, so here's the trapezius, attaches on to the spine of the scapula up into the cervical area, and look how far down it goes, all the way down to T12, which is your 12th thoracic vertebra. So you're going to use a tennis ball right here, and the belly feels typically good, but you got to be careful, don't put too much pressure in through here. Then you're going to scroll down up and through here and up and through here. You can even, on a 4th point, get up here in the neck, but you got to be careful with this because this can make it worse if you mess around with this area too long. So here's a great stretch that I want to give you to help loosen that trapezius. So you can kind of like get on the floor or on the bed and just kind of go like this, and you're going to lean into it like this. And you can just kind of roll forward, and you'll feel that stretching. But do the tennis ball first, and then you can do the other side like this, and just kind of roll. It feels, just even doing that, it feels better. It feels so much better. Now here's another thing you can do in regards to a stretch or an exercise. You're just going to bring the shoulders up and back, and hold. Breathe in, up and back, and just do that. Bring it up and hold it there for a second or two, and just let it drop. And do like 12 of those. And when you do that, you're just dissipating all this energy and tightness that was in there. The shoulders already feel a little bit better for me just by doing that. So that's a great way to handle it yourself. What we like to use in our office is the energy pressure wave technology. This is awesome for getting rid of this pain. There's nothing that works better for this. We have this gold tip. There's different types of tips. There's a ceramic tip, there's a gold tip, there's a chrome tip. The gold tip goes the deepest and penetrates so deep into that trapezius muscle, it just knocks out that scar tissue and that pain in the heartbeat. So you just put it in here like this, and it just acts like a jackhammer to loosen it. In the spot that's really tight and bothersome, you'll feel a little more discomfort in there. But when you're done, that pain is like gone, and it just feels amazing. And sometimes you can knock it out in even 1 visit. Sometimes, mostly it's maybe a few visits, but this technology is awesome for getting rid of this kink in the neck. But Even if you just use a tennis ball though and do that little stretch and do that on a regular basis, it's going to help quite a bit to help relieve this tension. One more thing, when you're sitting too, if you're on, let's say you're not just working on the computer like this, but even if you're sitting at a chair, you got to be careful. You have a chair like this with arms and you sit like this, what happens? The shoulders go up and just make this tighter. So just want to be careful, aware of that. If you do have a chair like that, just get up. In the day you can do that stretch, you can do this like this, just like as a break, and that should help prevent that kink from developing and you having that shoulder pain. I hope this video has been helpful and you benefited from it. And this is Dr. Derek signing off.
Hi, my name is Megan, and before I came in and used the new technology, I was having incredibly painful aches on this shoulder. Every time I roll it back, it felt like there were knots twisting and turning, and it was incredibly uncomfortable. I'm a personal assistant, I'm a performer, so my jobs take a lot of toll on my body, and after Dr. Taylor used the new technology, I feel almost no pain anymore in my right shoulder. When I roll it back, there's no cracking sound, there's no crinkling feelings, nothing. It's pretty much all gone. So thank you, Dr. Taylor, for using the new technology on me.